Okay, I'm going to call this meeting to order. This is the Incarceration Prevention and Reduction Task Force Behavioral Health Subcommittee. We're meeting here on June 15th. This is remote. We're meeting via Zoom. And before we begin, I'd like to do a land acknowledgement statement. We acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, and Samish and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that brings us here together today. And please join us in uncovering such truths at all in any future public events. All right, and I'm going to go to our second item here this morning. This is the 2021 committee priorities. And I believe that's Mike Parker and myself here that are going to take us through. So we thank you for folks that took the survey and submitted your responses. We definitely appreciate that. This is an effort to guide our work moving forward. And I don't know, Jill, can you put that those responses up on the screen here? It's the I can't remember what packet page it is.
Jackie, can you reshare the packet again, please?
Yeah.
Sorry, we're just going to kind of stumble our way through this here a little bit here. Okay. There we go.
What you're looking for?
Yeah, that's exactly.
Okay.
All right. So the first, the item that gained the most points was service capacity, and that was expanding local behavioral health staff capacity, however possible. You know, a lot of these items, you know, just in looking through this, there are things that are really beyond the scope of an advisory committee, which is what we are. I think that we're identifying where our gaps are in service capacity, and this obviously rose to the top. I'm looking for member feedback on this item, and then I want to go through racial equity, the GARE piece, and then a couple of other items, and I want to prioritize maybe 4 of these items for the rest of the year for us to work on. I'll open up the floor for service capacity questions or comments on folks that took the survey and those that didn't.
Dan, should we just go ahead and jump in? There were some folks with hands up, so I wasn't sure. Jackie, I think I saw your hand up, so maybe Jackie, if you want to go.
Yeah, I can't see hands.
Oh, okay, great. Yeah, I just wanted to say that with regard to capacity and the workforce, that we at the health department have been working quite heavily with the Administrative Services Organization, the ASO, and the Healthcare Authority, and we think we finally have made progress in getting them to understand that this is a statewide issue, that the lack of workforce is a statewide issue, and that it has to have a statewide response. And so we're still working with them. We meet quite regularly on the topic and discuss it in great detail. And initially, they didn't understand it, and they thought if they just threw a few incentives out there that people would come, you know. But now we've got them understanding that it's deep and thick and what some of the details are. So I think this is being addressed at a much higher level and probably needs to continue to be addressed at a higher level.
Jackie, what can this committee do to support those efforts?
That's a good question, Dan. I hadn't really thought about that. I think I'm not sure there's much the committee can do on its own, but I would be happy to have the health department continue to report back about progress that we're making. And if we can figure out something that the committee can do to support the work that the ASO and the counties, and that would be all the counties in the state are doing, then I will certainly, we can let you know. Does that work?
Yeah, I mean, this is such a entrenched issue. I mean, this is it's a workforce issue, it's a pay issue. Um, it takes unique people to work in these roles. Yeah, I just see it as something that's very complex and kind of above our pay grade to some degree. So I want to make sure that we can advocate in whatever ways make sense and support the health department in moving this item along.
Absolutely. So we will definitely come back as things evolve and we know what's happening, and let this committee know what's going on, because it definitely impacts the level of services, particularly with regard to those with the most serious mental illnesses and folks being funneled off into private clinics to work with people who have less serious illnesses. So, so that's a deep concern.
Okay. All right. Well, thanks for your continued work on this. I'm going to go ahead and recognize a couple of people here. And I apologize. I didn't see the hands up in any order. So I'm just going to go ahead and call on Heather Flaherty, then Stephen Gockley.
Thank you. Good morning. Jackie, thank you so much for sharing that information. I'm hearing about this in every single area that I'm working in. And I hear you when you say that it's a statewide issue and we need a statewide response. And I'm thinking about, is there a local county focused response that we can be doing parallel to a statewide response? So I guess I'd love to just understand more about the plans and where we can plug in locally to do things like, work with Whatcom Community College on expanding programming, or going to the 5th grade classrooms to teach them about behavioral health career paths, and like, what are the things we can do faster at a more local level, knowing that it's going to be probably a generational like trajectory that we're going to need to be changing here. It's going to be a 10 or 15-year plan, I feel like. So so I hope this doesn't just go off our agenda and say, okay, let's let the state deal with it. I would love for us to also be, and it doesn't sound, I'm not saying that's what the health department's doing, but I'm saying, like, for our committee and for local people who are involved, I want to stay involved and be part of that solution.
Hey, Jackie, can you give us a gallery view and take the agenda down for just a second? I want to see people's faces. I want to talk to Heather here. Okay. Heather, you bring up a good point. I think that it's really easy for us to kick the can down the road here and just say it's somebody else's problem, and I don't want to do that. I think that we're uniquely qualified to come up with some solutions here, or at least recommendations. And I want to stay on that piece, because I think that there is a value for local influence on this one. So thanks for those comments. Stephen Gockley, go ahead.
Thanks, Dan. I'm somewhat on the same track as Heather, I think. I really appreciate the encouraging news that Jackie and Ann and Perry are getting the attention of state level people. That's a multi-year process at best. And I think within the scope of this committee, we're seeing capacity issues that affect Grace and Lead, drug court. And my understanding is that part of it is we don't have enough practitioners, but also that we have disincentives for participation with Medicaid patients. And so I know when I was on the WAHA board, and Heather was there with me, WAHA managed, I think it was 0.1% sort of screening behavioral health referrals, which did one of two things. It recruited a pool of existing providers, and it managed the flow of those so nobody felt like they were going to be inundated. I wonder if there's some way to recruit from within the existing capacity, and maybe even incentivize with some county dollars adding to the reimbursement rate for some providers to volunteer on a managed basis a number of the people that we're dealing with in this community, so that we have a little more immediate, a little more responsive kind of system that can take advantage of those providers we do have. Something like that that's in the shorter term response to some of the concerns I think we're gathering from the professionals themselves, and encourage them to participate more in some of the activities that this committee is trying to promote.
All right, good thoughts, Stephen. Thanks for that contribution. Arlene, go ahead. I think you're muted. There you go.
Sorry. I want to advocate for activism. I think that the members of the task force are uniquely knowledgeable about what our needs are in this community and can personally advocate at the state level. We have to look at where the power lies, and then you want to inform and nudge the power to do what they're supposed to do to make sure that we get what we need. It is possible. I just think that we have to go a little bit outside the usual box. And because I can already see that's happened with certain other things that we've advocated for over time. And now we're starting to see funding coming down from the state level and even federal level for certain things that we're wanting, such as more money for housing, which is high on our list of priorities, I think. But staffing is absolutely number one. It was number one on that list. So, yeah, I mean, I would say talk to everybody you know and whatever connections you have, and just keep repeating it persistently over and over.
Parker.
Yeah, thanks, Dan. When I saw this, I also thought, and I was remembering comments by Sheriff Elfo about vacancies. So as I think about our role, we're really focusing on behavioral health, but we have a lot of officers who are working with folks with behavioral health challenges. And I think our workforce shortage extends a little bit beyond just our behavioral health folks. So I do see Doug's name here. I see Chief Tanksley here as well. And I'm just curious from a law enforcement perspective, we heard from Deputy Executive Schroeder that there have been vacancies in the county. They didn't specify which ones, and that they're likely to refill those with some of those dollars. So I'm curious, as we talk about workforce and as we talk about workforce shortage, how is that looking for law enforcement? Is that improving? Are you facing those same challenges? Should we be thinking, I guess, a little bit more broadly than just a behavioral health specialist?
Mike, I can speak on behalf of the Sheriff's Office. Obviously, we do have, for our agency, a significant number of vacancies on patrol right now. I believe we're down 6 deputies, and that's significant for the size of our agency. One of those positions that's currently not being filled is one of our 2 mental health deputies. And as you know, that's a program that we instituted a couple years ago to respond to, focus primarily on mental health and those persons that we're calling in to dispatch, similar to the GRACE program, kind of focus on those people with the most need and trying to put them in contact with resources. So, those deputies work closely with the GRACE program lead. They attend a lot of the different meetings so that they know what resources are available to refer folks to. But I would also, here next month, there's going to be a significant change for law enforcement. We're mandated to not go to certain calls or leave certain calls based on a list of criteria. And I know that we utilize MCOT, and we're utilizing MCOT more. And quite frankly, they just don't have the resources to keep up with the demand. And our concern is that's going to continue. And as Jackie said, and this committee's talked about, there's a significant workforce shortage when it comes to behavioral health specialists. And that's something that's going to have to change if we're going to be able to respond and meet that demand. I mean, crisis stabilization unit, these different programs are great, and law enforcement with this new legislation is mandated to divert to those type of programs. But if there's no room or no practitioners to deal with that, that's a gap that has to be filled. And you're right, it's going to take years to come up with a kind of workforce to support the community's needs.
And I would also second what the undersheriff said with regard to the legislation. Certainly is going to have some constraints on law enforcement. So as you all might know, there's at least 13 bills that's going to affect the way that we do business here in the state of Washington. With regard to the staffing here in Blaine, right now we are down 2 officers, and essentially it's because of retirements and officers gaining employment from various agencies. For example, we lost one to the Sheriff's Department. We lost another officer to Alaska State Troopers. So in law enforcement, oftentimes you have officers that switch agencies or continue new career paths and doing other things. So that does strain our agencies. Not all the time, but sometimes. Like the undersheriff said, with regard to freezing positions, we only have 14 commissioned officers here that do a lot. So our officers are first responders, they're their own detective. You know, it's a utility type of position. So, you know, we plan to fill those positions. However, with regard to answering calls and the resources that we have, it's going to change in about 45 days. So we're just, you know, hoping that it doesn't affect the community too much, and certainly we'll be working with our other stakeholders in the community to make sure we provide what's necessary. So thank you.
Thanks, Chief, and thanks, Undersheriff. Mike Hilly.
Yeah, thanks. And appreciate the law enforcement chiefs talking about that, because EMS is starting to feel the shift of that responsibility on these calls. You know, EMS is the last safety net anybody has to get help out there. So EMS is shifting to some of these traditional law enforcement responses. And so we're starting to struggle with what that means, authority, how to help people, these 12-hour holds for suicide ideations, et cetera. They're falling through the net. And we think we can help. We got into this conversation about workforce development with the Grace leadership team here about a week or so ago. Millar has identified on a couple of those meetings that we're having a tough time, you know, hiring a social worker for those positions and keeping them going. And you know, that field work is a little bit new to the industry. I'm not saying that the social workers have not worked in the field before, but in the last 18 months, we have an explosion of this type of work that's now available for social workers that traditionally wasn't there. So as we talk about the lack of shortages, we also wonder, well, can we just do something ourselves locally? And I think we can train some people, primarily with the community health worker type of curriculum, some basic de-escalation, et cetera, where we can train people to maybe do that work. Of course, my current target is already vetted EMTs that are pretty good with working these types of patients. In fact, we employed 3 EMTs over the last 3 months to work at base camp to provide transportation for the COVID positive patients out of there. And the side benefit of that has been is the EMTs in that facility have provided a large amount of help and navigation and understanding of what's going on in the community. And it's actually helped decrease some 911 calls. But we have some EMTs that would be probably easily trainable for that type of work, but they don't have to be EMTs. You know, in fact, one of the social workers on the team now didn't really have that background. She had a psychology degree, but she had previous experience in healthcare and had a lot of experience working with vulnerable adults. And so that skill set kind of backed into the really good successes that she's doing now in that field, but was not ever a social worker. So for local and especially the emerging thing coming up here in the next 3 or 4 months, it might be good to explore, what type of training that we could bring in entry level or tech level people to go out and do that field work, and then have it managed or program managed by the social workers and the people with the degrees that can train and run the programs. So that were our thoughts coming out of the meeting. We're worried about it. Grace teams are trying to expand, but yeah, we just can't find the workers for them at the moment.
Thanks, Mike. Mike Parker, and then Arlene.
So we've got a lot of conversation on this particular topic. I think it shows how important it is. I think it also shows, we've already brought up two distinct but really closely allied professions that are being heavily impacted by worker shortages. And if our law enforcement is just as sparse as our behavioral health specialists, we're going to have multiple problems. I don't want to expand the conversation too much, but I have one thought is that our nonprofits are facing the same issues. So people with human services backgrounds, interests, I see Jackie nodding, she knows she contracts with a lot of them. So this is really kind of a broad community issue. And Heather, I know you've been part of a lot of productive community conversations. And I'm just curious, as this is affecting so many areas for our community, about a broader discussion. And I know the health department is kind of leading the charge with the ASO, and thank gosh that is happening. But I'm wondering, I'm just hearing so much. Would this be worth it? One, to take offline, we won't solve it today. But two, to cast a little bit of a net to look at our workforce and to see, short-term, long-term, what can we do? And I just want to second those who have brought up local capacity, because even if we don't solve everything locally, we might be able to make incremental changes and do them quickly and nimbly. And I'm thinking of like nurse partnerships and things that Chuckanut Health Foundation has funded when they've recognized scarcity with certain professions in our area. I think we have capacity and interest. So, but I am thinking, Dan, just in terms of our time and a venue, what might be a good way to go. So if anybody had thoughts, or maybe Jackie, you, about how we might continue this conversation, but more broadly and inclusive, because I hear Grace talking about it, we're talking about it, maybe we should get together. If any thoughts on that?
You're asking for my thoughts, Mike? Is that what I'm hearing?
Yeah, I mean, does your conversation seem like the container that could be broad and inclusive and talk community need, or is it pretty focused and maybe that should live elsewhere?
Well, I think what I would describe it as a little vague right now. What we've just accomplished, just barely, was getting the healthcare authority to understand how problematic it is and getting them to understand that it's a statewide issue. And that was a big coup, because before they just thought it was one little county complaining about an issue that they didn't really need to solve. But it really is a much, much bigger issue. So, and it doesn't preclude, as Heather says, I think maybe us, this committee having some impact in some other ways. I just don't know what those would be. And maybe the best thing to do would be to brainstorm a bunch of ideas at some point and then go from there, because brainstorming kind of allows that free thinking, out of the box sort of, no holds barred, don't edit it kind of thinking. And then from there, you can bring reality into the picture, and kind of begin to recognize some of the things that you can't tackle as a small community. And maybe from that will come those things that could be addressed. I don't know, just a thought.
Okay, before I recognize other speakers here, I just want to do a time check. It's 9:29. We are on the first item of the priorities checklist. We've got a whole agenda to go through here, and I want to make sure that we give weight to everything that that you all thoughtfully put into this. So I want to just remind folks that we are on a timeline here, and I see Arlene's hand up, and then Heather Flaherty.
So I would like to speak about the reality of the people on the front line, what their experiences are, because I'm training new interns in 2 different clinics. I'm a supervisor, and I'm talking to young people going into the counseling profession. And what they're telling me is that they could barely live on the amount of money that they earn in these new counseling jobs. In order to make a sufficient living, they have to work too many hours. Okay, what does that mean? If you work too many hours in our profession, it will overstress you and burn you out as a worker. You have to keep your own emotional stability in check. So there's the money problem. They're not earning enough per hour in order to keep themselves stable. So if you don't address that, it's, we're not going to make any forward progress. The other issue I see is the training issue. What amount of training needs to happen for someone who is working with a population, many of whom have serious mental illness, not usual normal neurotic issues like a divorce or the loss of a parent or some marital problems. No, these are serious. If you take someone who's lightly trained with not extensive background in handling those kinds of behaviors and thinking patterns, you're actually you're at risk for making mistakes. And that's what's been happening all across the country, are mistakes in the way that you handle the behavior of the people who are acting out or acting up. So this is just I'm suggesting that it's very important to have somebody highly trained, in charge, at least.
Heather.
I'll be brief. 2 things. One, TechNet Health Foundation is more than willing to host a community conversation. We started this conversation in 2019 as well with the Diversion 2 gathering. We saw this coming with the kind of culture of getting people out of the jail. Well, where do we send them to? And just to underline Arlene's point, I think it's so multifactorial, and I could see some value out of a community convening around this, because there is workforce pay issues and the caregiver crisis. There are training issues. There are quality service ensuring that the delivery system's working issues. There's process issues and handoffs. There's innovation that we can be doing at a local level. Getting all that out there, it would lead to at least an advocacy agenda, if not some actual on the ground solutions that we can be doing now, while we're also partnering with our state to say, okay, raise your reimbursement rates, and these are the things that are in your power to fix. Here's the things that we're working on in parallel. I appreciate the time to discuss this, Dan, and clearly it's really important to all of us, so thank you.
Yeah, I think this is worthy of maybe a subcommittee of this committee getting together and trying to come back to this body with some recommendations. We spent the last 15 minutes talking about this. It clearly is an issue. We know it is. I mean, I think all of us understand that. I want to move us on though, because we still have more work to do. I want to take us to the next item on the priority list, and that's the racial equity. That's the GARE overlay. GARE is Government Alliance on Racial Equity. This group was the first in the task force to work towards a racial equity lens on all the decisions that we make. Mike Parker was the leader on this one, and we all I think recognize the importance of moving that work forward. Mike, can you just speak briefly to GARE and how we might, when we're making our decisions, when we in this last conversation, how would we apply GARE to what we're talking about with the workforce, gap, pay gap, housing gap? How does can you maybe just walk us through that real quick, and then I want to move us forward after that. Go ahead.
Sure. My apologies. I didn't prepare, but Dan knows he can call me on the spot and I will stumble through. So just to preface, I'm no expert in this. I'm hungry and I saw a vacuum and I think it's really important. So before I share any thoughts, I just want to start there. One of the key things, Dan, I think is already on the priorities, which is going to your membership. Did you look at your membership? Who's part of your membership? We are already enacting, actually, in some ways, and maybe they seem small and maybe they just seem obvious, but we are already enacting in some ways that, and the very fact that we bring it up at every meeting and the very fact that all of our members chose this is extremely important, is in a way modeling racial equity and a lens. Some key things also on that list is the comments to index, and Stephen led us through, and I really hope Caleb's okay. But Caleb wasn't able to join for our committee of the whole yesterday. But I think one of the key things about a racial equity lens in my developing understanding of that is you need to have data about who's being affected and are there differences in who is being affected and who is being targeted. We currently have some data. We can look nationally, and there are studies that we can point to. And Heather brought that out yesterday, which I really appreciated. We don't necessarily have to wait until we have a gelada that covers absolutely everybody. There are some small ways that we know that people are differently impacted. So Dan, what could we do? I think one of the really, really important things as a next step, and this is just my personal opinion, is I think we could, as an entity, as a committee, as a task force, and as a county, I think full GARE membership would give us additional support in exactly what you're talking about. I'm very pleased that the steering committee has decided to evaluate this in a formal way. And I would just say that jurisdictions can join in multi-levels. It could be the whole county, which could include everybody associated with the county and every task force. Although it can also start smaller. We can start with the committee and the task force. I would just strongly urge that because I think they would give us some additional support and some cohorts. I would tell you too, Dan, that going to your membership and getting feedback and decentralizing the agenda making, you in some ways are embodying exactly what GARE would do. I think an important step that we could take is attending information session on the 22nd, which is coming up very soon. And if people are able to, and Jill, I think we could probably share that information with behavioral health committee members to see what your organization might get out of membership. So it's not a very specific answer, Dan, but I think we can also use, as you look at that list, when I filled out the quiz, I kind of used that in my own head as like, well, what do I know about different populations in Whatcom where I live? And what information, what does that lead me to saying what's important? And I think it kind of infused every answer that I gave, which is why I chose service capacity, because I think if like Arlene said, if we don't have people willing to help folks whose mental health situations are so bad, they're disabling, that affects people disproportionately in poverty, by race, by any number of issues. So I guess I would say in that way, we are at least tacitly employing that in kind of a beginner's kind of way. And I think we can continue to do that further. I'm pleased to see it as high on the list as it was, Dan. I just wanted to call that out. I think that shows a real value. But I think data is going to be really key. So if you weren't privy to Monday's conversation about index and data, and maybe some interim solutions where we can know who's in our jail, who is going through courts, who is reentering successfully, who is going back and not reentering successfully. When we know the characteristics of those individuals, it will give us the necessary things. So I think for us, applying the toolkit says demand demand that we figure out solutions. Not that we have an instant system, not that we overstress index and Caleb, but we put that as a value that we want to know about those things so that we can find out where our trouble spots are. We can also find out where we're winning. So I'll stop with that. And hopefully that covered at least a little bit, Dan, of what you were hoping to hear.
Okay, Jill Nixon.
I just wanted to let you all know that at the urging of some other task force members yesterday, I issued an invitation to Dr. Alexis Harris at the University of Washington to present to the full task force. And of course, all of you who aren't on the task force are welcome to attend. Hopefully we'll get a response from her soon and we can set that up with her to have these discussions, hopefully in September.
Okay, thank you, Chief Tanksley.
Yes, so as we have these conversations about data, it occurred to me that when I worked for St. Louis PD, anytime we talked about this type of data, which is a broad range of data, that we had Missouri State Probation and Parole at the table. And when you take a look at, we could certainly take a look at our regional data, but when you talk about reentry and recidivism, I think probation and parole needs to be at the table, although perhaps that's already happening and I don't know about it, but I just wanted to throw that out there.
Thanks, Chief. Stephen Gockley. You're on mute.
Sorry, I want to echo Mike's promotion of GARE and that information session next week. I also want to underscore his emphasis on the data lack that we have, or the importance that that plays in utilizing the racial equity toolkit. So I think there's a lot of concentration to be made there, and we can probably make some progress there. Arlene yesterday talked about the cache of service utilization data that the ASO probably has. And I think we need to understand who is using and who needs to use services from a racial equity perspective as well. And that can tailor what we do with workforce targeting as well. I really like the idea of a community conversation. If Chuckanut Health would fund that. Besides data, the heaviest lift that I see in the factors in the racial equity toolkit is the engagement of underserved populations in the processes themselves. We haven't done too much, despite really good leadership and efforts here in the committee, but that community convening might be an opportunity to hear voices of what underserved communities feel their needs would be in this regard. And I think that's really, that's a hard element to increase and include in the process of using the racial equity toolkit. But data and community involvement in policy process seem to be the two critical and the two most challenging factors to me. And I would think that's where we could target some effort.
All right, well put. All right, it's 9:43. We've got a whole agenda to move through. We've gotten through two of the priority items. I'd like to table the rest of the items that we need to discuss. I'd like to get through at least two more of them at the next meeting. Does that please the group? Can I get a head nods or thumbs up? Okay. All right, let's go to the next agenda item. This is good discussion. I think we all recognize that we have these issues that we've got to work through. Next item is America Rescue Plan Act funding, and this is Mike Parker.
So I'd be happy to kind of get us going. And as there are some folks that were here yesterday when Deputy Executive Schroeder gave a really good presentation and shared what the county knows at this point. In it, there was a charge, and we're sitting at the end of that charge, Behavioral Health Subcommittee. So I'll just tee up that and then ask for others that were there to chime in. So as folks know, that act that Dan referred to, the Rescue Act, is kind of the second big batch of CARES dollars to come out of Congress. This is the much awaited one that will help Municipalities like Whatcom County and the city of Bellingham has its own separate funds to help with, to offset expenses that they experienced during the COVID pandemic. The list of uses is broad. The length of time is a little bit longer than the first CARES Act, where those dollars had to be out in a year or two. So it will allow for, like our county government, for example, as Tyler mentioned, will be able to backfill positions that they've had to freeze for the entire pandemic, right? So there are some things that we already are known and that executives to do and others know are instant priorities. That being said, there's also room for input, and there was actually a request for input. So one of the things, one of the uses of this American Rescue dollars are behavioral health and helping fund interventions and maybe even bonuses to get people back into the workforce. It's kind of directly, we could apply some of the previous discussion and have carried it right over. Those are allowable uses because they recognize that there may be a whole list of issues facing municipal governments and systems by a whole bunch of austerity that happened for the past year and a half. So beyond what we know is going to happen, and I'm pleased that our county government, and I'm assuming Dan city government might be doing the same, where they're going to refill positions that they've been kind of starved to have. Deputy Executive Schroeder charged our committee with suggestions about what would be key areas from the opinion of the behavioral health subcommittee that would be most effective. Some of these funds could be used to aid us in efforts. Some key things I think to think about, and then I'll turn it over to some other folks that were there, were that it's not ongoing and forever. So if it's capital dollars, it can go a little bit longer. So we should be thinking of things that are quicker, or a more immediate impact. These funds would be much more applicable for something that we're doing in the next few years. Not a good 10-year plan, but a really good initial plan. They also can be used for some capital needs, although this committee has not tended to talk about that. We have tended to talk about services, the humans that provide those services, and the other humans who receive those services. So that has tended to be our focus. But I would just mention too that capital projects are available. But I thought his charge was okay. And Stephen or Heather or Arlene, any of you that were there yesterday, I wanted to make sure that I fairly stated his charge to our subcommittee, and I'm not sure I phrased it well, but I would just invite other lens on Tyler's talk yesterday.
Any members? Arlene, go ahead.
Yeah. What about this list of priorities that we just put up on the screen? And I mean, that's certainly a good direction to use. And then, maybe just we can't, well, I guess we could make a list with everything we want on it, because when you negotiate, right, you ask for the moon and then you get the stars. So why not ask for everything that we want? This is the way I've approached my advocacy is we want these 8 items, these 11 items, and then they're in a list of priorities. So we'll get whatever we'll get. But if we, it's essential for us to really press hard on the things that we're asking for, because what have we been doing for the last 3 years is just finding out what we need, trying to figure out what we have and then what we need. So this money can give us what we need. And so all we have to do is focus down and give them a list and press really hard for the importance of the priorities.
Stephen Gockley.
Thanks, Dan. Thank you, Arlene. Mike, I thought you did a good job of summarizing Tyler's presentation yesterday. The only thing I'd add to that is one of the things he clarified is there are really going to be 2 phases to how the county thinks about using that money. The first will be the backfill reparative allocations of money to take care of deficits incurred during the pandemic. And then in the fall or so, they'll be looking at a second tier of funding needs that might get into where our interests would lie. I think to add to what Arlene said, I think there's a lot more work than just saying, let's give them our list, because they're looking for specific articulated needs. And to say service capacity, let's push service capacity, that doesn't do anything for them. And that's not adequate to guide the allocation of money. So I think we need to do some work to really focus what our request would be. And the last thing I'll add is one of the things that caught my ear, and Tyler, in his usually savvy way, saw this from the beginning. There is potentially one of the priority areas for the funding is public health related data development. So he said, and that fits us here perfectly. The task force looks at criminal legal data perhaps, but he said a lot of it, correctly, he said a lot of it is public health related, behavioral health related, and that's who we are here. So if there's a way that we could target a funding request that would address the data needs that we just spent a while talking about in a public health way that perhaps integrates with other needs that the health department has, it could move some of our work, the racial equity part and some of the service capacity even agenda forward.
Heather Flaherty.
I just want to offer, I started to build a framework for this conversation on the children's side, and I'd be glad to share it. I don't know if that's helpful. It's just, I think this conversation can get so big and dreamy, and I really think, Stephen, you're right. Like, our county government and leadership needs really specific examples here. So I could flash it on the screen, or I could just describe it, or we could move on, and if people are interested, I can share it later too.
Heather, can you just briefly outline what you've got there?
So there's it's a giant spreadsheet. There's 3 big goals. And so, for example, first goal, children are safe, healthy, and ready to learn. There's a couple of strategies, right? And like, we have some strategies here: develop workforce capacity. And then there's some categories. So we have, for children, it's regular access to comprehensive health services. So categories are behavioral health, healthcare, specialized care, and justice involved interventions. And then going to the program and actually listing what are the programs. And we could also have a facilities list, right? If facilities are a short-term, big ticket item that we could spend some of these funds on, I think we probably, that's a more sustainable way to use those dollars than creating new programs. And then you can go through, I looked at the Washington State Institute for Policy cost benefit analysis for all the different programs, what age range they would be, where they fall on the PETA continuum. So there's I think having some sort of framework to fill in, and then the cost, right? And how many people we think that it would impact. That could be really helpful data for executives to do in some of those recommendations.
For those that don't know, that Heather's been a leader on upstream children's initiative and intervention programs for years now. And I know that many of the folks on this call here share that perspective, but Heather's been just an absolute leader on this. Other committee members.
Heather, would you be willing to send your spreadsheet to Jill for distribution to the committee? It could be grounding for some other conversations.
Yes, it's still a draft, so it feels like I'm sharing a piece of my diary, but I trust all of you, so I'll share it with you.
Okay, that'd be helpful. Thanks, Heather, for doing that. Appreciate it. Any other thoughts on this item from committee members?
So Co-Chair Hamel, one of the things that strikes me is that sometimes conversations get going, and on our first list, they really got going. But also we have a duty to keep to people's time. And much as Heather is doing, sometimes when we do things outside of these meetings and we get some members joining, we're able to go further down those conversations. We don't have to curtail them to keep to an agenda. I have to be cautious on what I offer, but I'm wondering if maybe a small subgroup of us wants to think about working on some of maybe the top 4 priorities and doing some brainstorming and maybe trying to think about what type of interventions would be useful, what could we boost on service capacity to kind of take that somewhere. As Stephen so rightly mentioned, the fall, when the second tranche of dollars comes in, is not far. And this group has, members of this group have talked about a couple of things offline from this and have been quite productive. So one is Stephen has championed Shelter Plus Care vouchers that are a housing authority resource, combining it with Grace team members to try to target housing to some of folks. Another one of our members, Byron Mannering, has led us down a role of looking at pregnant and parenting women and treatment programs for those that are criminal justice affected. I guess I want to offer that maybe, and I don't know, Heather, if it's something that we can do as part of a convening. You mentioned that maybe Chuckanut Health Foundation might have a role in certainly convening about the workforce shortage, which affects so many of us, whether that be a behavioral health or law enforcement or a nonprofit social service agency. What might be a way that we could continue this conversation, but outside of this meeting, and then have it come back into the meeting? We've got some great feedback from our committee members. Thank you all for doing the survey. And it's rich data, actually, to get the brains that provided their opinions on that, I think is really powerful. And I think we could turn that into something of a directional report, but it would just be a framework. We would have to flesh it out. So I just want to stop there, and maybe that's an ask to Heather. Does this seem appropriate and something you're already taking on framing up the youth one? And it's okay to just tell me no.
Are you asking if we would maybe I could invite, we could have a separate conversation? I'd be glad to do that and happy to share my framework and see if we can. I love that idea of taking the top 4, maybe even 5 priorities that showed up on the survey, and inviting any of you, all of you, honestly, if you want to spend a couple hours and do this, I think that would be really useful. And I hear over and over again from council and from county leadership, we need specifics. We need specifics. What do you need and how much does it cost? So let's go get specific.
Who wants to volunteer for that committee, that subcommittee? Arlene, Mike Parker, Chris Cochran, Michael Smith. Heather, you okay with chairing that one? Okay. You know, I want to let folks know I don't like rushing through the agenda. That's not my preference. But I'm duty bound to carry us through as best I can. And Co-Chair Parker, you absolutely, you're right. The subcommittee was forefront in my mind on trying to, like, how do we actualize these items? Jill Nixon, go ahead.
A couple things. First of all, for those of you who want to meet offline to discuss any of this, I would just please ask that it be 6 or fewer members of the committee. Otherwise, we're going to run into Open Public Meetings Act boundaries. And Dan, as far as today's agenda concerned, my item, which I think is the last one, I can reduce that down to 1 minute. So that should give you a little bit of time. Okay.
I count 1, 2, 3, 4, 5 people that volunteered to be on that subcommittee. Michael Smith, Heather Flaherty, Chris Cochran, Arlene Feld, and Mike Parker. I think if my public school education serves me, I think that's 5 people. All right. Thanks, Mike. That was Parker. That's a great suggestion. I think a lot of this work has to be done out of this room, basically. So thanks for bringing that forward. I'm going to toggle real quick here to the agenda. Give me 1 second. That was the okay, hold on a second. That was the ARPA discussion. And then the next item is item number 4, new funding streams and recommendations based on the strategic plan. It's 9:58. We have got about a half an hour left here. So I think the new funding streams are referring to House Bill 1590, which was passed locally with City Council for $3 million and County Council for $2 million. We are in the county side of the House right now, so I'd like to contain the discussion to county funds, which is $2 million. If for folks that don't know, House Bill 1590 provided councils both at the municipal and the county level to councilmanically, which is a weird term, but it means basically that the council can pass this legislation to enact a 0.1% sales tax to provide for housing and mental health services. 60% of the funding needs to go to housing. The balance of the 40% can go to services. Although I think the whole allowance can be spent on housing. And so the question here before us is there's that item. So 1590, there's also House Bill 1406, which was passed, I think 2 years ago, and that provides for additional funding. It's about 700,000 at the county level. So Jackie, you might know a little bit more about that, or maybe Brian might know a little bit more about that one than I do. But those two items are, I think those are the pieces that we're talking about right now. And if there are recommendations, I think 1590 is the animating player in this one in terms of what Behavioral Health Committee would be talking about. So what we're looking for here are recommendations from this committee on how to spend those dollars to provide a recommendation to the broader task force and then consequently to the county council. So I'll entertain any thoughts if folks have them at this time. Mike Parker.
God, I feel like I'm always first. That's terrible. I think one of the things, Dan, when I think about what those funds can be used for, both housing and behavioral health, I don't want to be overly simplistic, but we need housing for people with behavioral health challenges, and we don't have enough. And Mike Smith over here is working with folks who, when they don't get housing, they need co-occurring treatment and they need residential treatment. Well, what about having that spot when they get out? So much like what I mentioned, Stephen Gockley convening a group to try to address, a particular niche issue. I really think that housing for folks with behavioral health disabilities is absolutely critical. I mean, it is the people that are, when they're forced to live outside, they're involved in crime just to live on the streets. It's illegal to live on the streets and to make your living on the streets in many pieces. So they're so inextricably intertwined, behavioral health affected folks, and severely so, much like Arlene mentioned, and our criminal justice system. And we know that one of the key things, we know that when people are housed, they offend less. We also know that when people are housed, they hurt less and they can begin to heal. And so I just going to bring up the facts of the matter. I know we've got a housing expert in our group here, and who administers a really large grant. The Shelter Plus Care program is extremely successful at targeting folks with mental health. What does it look like to expand some of the things this community knows how to do? What would it look like to target resources to folks that are coming from our criminal justice system? I mean, I think that is a really key thing, is that we know that the issue maybe of homelessness is so broad and so impactful. Yes, that's true. But I believe with targeted, really smart, data-driven investments, we can make differences in people's lives. So I'm just going to go fundamental. I really think we need to get housing for folks. And if there's a possibility between the funding that came out of the legislature this year, between ARPA and any other HUD programs, I just think we need to capitalize on that. So I'll just say that and stop. And Brian, I'm interested if you have any thoughts on that.
So I also wanted to follow up, and sorry, Brian, I didn't mean to cut you off. I do know that the executive is wanting to put at least 60% of the funds into capital projects, and is also interested in supporting some of the crisis services projects that are currently evolving and developing, such as the art response and the crisis stabilization center. I also know that the Administrative Services Organization is in contact with the Opportunity Council about some funds that they're getting from the Department of Commerce, quite a bit of funding, I believe, for rental assistance, and which could help develop capacity if we had, places to actually put people. So that's been another issue that we've been talking about broadly, is the workforce the lack of workforce and the lack of places to rent, even or even places to purchase, I think, that aren't, completely out of, I don't know, in outer space crisis. But I wanted you to know about the funding coming through the ASO. The ASO is getting quite a bit of funding in various areas and is developing plans. And I could be maybe more articulate about that in the next meeting, perhaps.
Thanks, Jackie. Brian Thane.
Thanks, Dan. So both 1406 and 1590 funds have also been put before the county's Housing Advisory Committee that's staffed by the Department of Health. And they are supportive of the executive's desire for at least 60% to go for capital funds for housing. I completely agree with you, Mike, that we need more housing with support for folks with behavioral health issues, which seems to bring us right back to the first topic of discussion today. And our the Housing Authority's Shelter Plus Care program is not fully utilized, at least in large part due to the lack of case managers, which are a requirement of that program. So personally, I'm hopeful that with 1590, we've got an appropriate tool to start chipping away at that.
Brian, if I could just follow up, you've got that expertise in terms of development. And I think some people have brought up the idea of a capital project, especially with some of the ARPA funds or maybe some one-time ones. Could you maybe just share your thoughts, opinions on how feasible is it to lift a project off the ground relatively quickly? Is that a feasible ask, desire to create new housing in that window of time with ARPA funds? Or does that, based on your knowledge, should we be looking at something that is a little different than building new?
The challenge, the timeline challenge with building new is having a site. And as far as I'm aware of, other than the Forest Street site that OC is targeting for a senior development, not sure anybody's sitting on site control of a specific site at this point. We're all out there trying to identify that next development site. The Housing Authority also has an interest, and I know other housing providers do also, in potentially acquiring existing properties and essentially converting the use over time. Also, simply by acquiring it and operating efficiently, the Housing Authority, anybody, is sometimes going to have to raise rents, but we don't have to raise rents at the market rate. and over time, the publicly or nonprofit held housing can naturally become affordable housing as we merely seek to break even on our expenses rather than get a return on investment like the market looks for. Also, currently with crazy supply chain issues we're facing, and lumber being 3-4 times its historic average, acquisition can be done much more for less investment.
Okay. Thanks, Brian. Yeah, a sheet of plywood costs $70 right now. So, just let's have that under consideration. Stephen Gockley.
I can't speak highly enough about Brian's skills in the development world. But in this context, a number of the conversations I've been in about treatment-related supportive housing seem to emphasize the value of having a moderate size capacity, but not a huge apartment building complex size. So it seems to me that there probably is value in exploring the acquisition or rehab of existing buildings. And that doesn't require a site. It might be a quicker fix. It requires partnerships, obviously, as the conversations about shelter plus care that Mike has mentioned a couple times are starting to reveal. But it seems to me that also fits within the ARPA timeframe for creating some usable supportive housing sites. And so, Brian, would that be something that the Housing Authority might be an owner or an instigator or partner in? Because that's a side of your business that I'm a little less familiar with.
Go ahead, Brian.
Excuse me, we absolutely could be a partner in any way that is helpful on an endeavor like that. And I also remembered I wanted to offer up with the ARPA funds, it can only be used for affordable housing in a federally designated qualified census tract. It is not generally an allowable use for those funds. That was included in the facts that I think this committee shared from Tyler Schroeder yesterday. So there are a limited number of neighborhoods in the county where we could do that. Raises the bar a little bit.
Right. And I'd like to point out that the leveraging capacity on these funds can be up to, well, it kind of depends on how you measure it, up to either 8-to-1 or 10-to-1. Brian, I think that your Samish Commons was even bigger than that in terms of what you were able to attract for outside dollars. So it's not just the 2 million that will be raised with the 1/10 of 1%, times that by 10 basically. And now we're talking about, real money. And Brian's right. We've got to figure out where we're going to, if we're to recommend like a facility, development, then we need to figure out where it's going to go. The county does not have a home fund, only the city does. And so this would effectively create a similar kind of fund. When we started the home fund in 2012 and began collecting in 2013, we were at $3 million per year over a 7-year term, $21 million total. This is $2 million. It's $1 million shy of that. So it's a little bit less, but it's not that much less. Other committee members, input? Okay. All right, Mike Parker, go ahead.
I was just going to offer that other, there are other solutions. So I brought up the brick and mortar of building something. Lake Whatcom Center has a demonstrated capacity of obtaining smaller buildings and folding it into a really impressive system. So obviously in the buying, and there's also other types of housing that have been useful in the past for folks coming through criminal justice systems. I'm thinking of, they used to be called halfway houses, but recovery houses and things of that nature can also have a place. They may be easier to lift off the ground. We might be able to obtain things. So maybe a conversation, and maybe, Brian, that's happening in the Whatcom County Housing Advisory Committee. And maybe that makes the most sense in terms of what type of intervention, what can be lifted off the ground in what time frame, and what makes the most sense. I think from this committee standpoint, and one of the things that I think is that we need housing for folks who have traditionally not been getting it, and the folks that we're seeing through our systems. And the best way that we can target to get communities that are either underserved or overserved in the wrong ways, depending on how you look at that. Who are we frequently arresting because they're unhoused? So we might be able to at least provide some targeting information. So I brought up the behavioral health folks. There are other populations of concern and of interest who experience homelessness at different rates, and thus are going to be in our system at different rates. So I think those are valuable things for this committee to possibly hone in on. Maybe we don't say build new versus obtain, but maybe we are saying we would really like to see focus on the people that we see coming through our system that we don't think we're serving well by incarcerating them.
Co-Chair Parker, are you suggesting that we have another subcommittee that addresses this issue of how to figure out how to spend down the $1590?
Well, I'm wondering if Heather would not see that as mission creep, if maybe we could incorporate that into a discussion about ARPA. It's not too much of an offshoot to just kind of incorporate that. And I want to just call out too that I see Megan Ballou has turned on her camera, and I'm wondering if there was a comment there. Hi.
Okay. Well, if it pleases the group, I would suggest that the ARPA group discuss 1590, priorities or ideas for county housing, whether that be acquiring existing or building new. Building new takes forever. I mean, let's just be honest. It's a 2 to 5 year process, probably closer to 5. But if we can figure out how to acquire existing, but also with the consideration that people live there already, so we don't want to displace people. But I think if that group can discuss those items and come back to the next meeting with some recommendations or ideas for discussion, does that sound okay to the folks that volunteered for that group? I'm looking for head nods. Okay, I got a thumbs up. All right, good enough for me. All right, good deal. All right. Okay, I want to keep us moving here. It's 10:17. I'm going to toggle real quick here. The fifth item before us here this morning is external communication and public engagement. Identify local agencies and committee groups that may be interested in receiving information on the work of the Incarceration Prevention and Reduction Task Force, and that is Jill Nixon is assigned to that.
Thank you, everyone. The Task Force Steering Committee is working on developing a comprehensive communications strategy. And one recommendation was for us to develop a roster of agencies, community groups, other individuals who we could outreach to about the task force's work. So I'm going around to all the committees and asking basically to go around the room, so to speak, and have you all brainstorm a list of agencies, groups, community groups who should be on that roster.
Okay, committee members.
I'll go first. Riveters Collective, Whatcom Democrats, Whatcom Republicans. The Community Foundation hosts a nonprofit newsletter that goes out to a lot of nonprofits. I think the Racial Equity Commission when it starts. And Sue and Christina now currently. And I bet the school district, I wonder if there's anything that the school district sends out. It seems like a lot of people get their information from those newsletters. Although I'm not sure how much people want to be reading about incarceration in school newsletters. So, but those are initial thoughts from me.
Thank you, Heather.
Other folks?
And if you think of something after the meeting, of course, feel free to email me with your ideas, and contact persons and email addresses, especially helpful.
I would be interested to know who would be the contact person to have this information disseminated at WW. I mean, that's a large population here in the area. So I know Darren Rasmussen is the chief of police there, but I'm not necessarily saying that he is the person, but it would be good to have that information on campus.
Yeah,
So that would be VP Donna Gibbs or Chris Roselli, who is their community, I don't know what the title is, but it's a community outreach kind of position. That'd be super helpful. I would also add in Opportunity Council does a newsletter that we get at our household. I don't know why we're on the list, but I don't know why, but anyway, that's probably a good outlet. And then BIAWC has a membership roster. The hospital has about 800 employees or somewhere in that range. I think some of our bigger employers would be on that list. Other committee members.
I think it should go to the homeless groups. There have been, I can't remember their titles right now, but there have been 2, 3, 4 that have developed over the last year. So it definitely, that information impacts that group tremendously. So I would suggest that.
Arlene, you could figure out who those groups are that you're talking
Yeah,
about.
I can't remember right now, but I keep getting, emails from notifications from them. So I'll look it up.
I think Road to Home, Jill, would be one. Serenity Outreach Services is another one that's been newly created. And then, of course, Homes Now, that's operating 2 tiny home villages, are some that come to mind when I heard Arlene speak. Those are some that came to my mind. I'm also thinking, we have Lake Whatcom here, and thank you for your representation. And we have the Lumbee tribe and the Lumbee behavioral health here. But that most behavioral health agencies may not have access to this information. So I'm thinking of really all of them, the Compasses. This is a matter of great effect. And I think about how many workers from Compass and Lake Whatcom are working with this population every day, but they may not hear about kind of larger initiatives, or that people actually care and are dealing with some of the issues that they face. So I guess I think of really all of our Medicaid servers, CMAR, Unity Care Northwest, and all those people that work in that industry would be valuable as well.
I would add in Lummi Nation and Nooksack, and also the small school districts throughout the county. Go ahead, Chris.
As far as Bellingham schools, I'd be happy to help with just certain people in the district that might be most beneficial or best fits in terms of our communications team, and then some of our unaccompanied and McKinney-Vento staff that are working with homeless families and students. So
great, that sounds wonderful. When we do start pushing out content to folks, I'm hoping that you and they will then be able to forward that content onto their own contacts through their own lists and newsletters. So that's really helpful. Thank you very much.
Other committee members? Okay, Jill, do you have what you need there? Okay, then I'm going to move us along here. We're at 10:23. Item 6 is other business. Committee members, any other business items that we for future discussion? Okay, I'm not seeing anything. That takes us to public comment. Jill Nixon, do we have anyone that is wanting to speak to the committee?
Jackie is running the meeting today. Jackie, do you want to invite speakers?
Sure. So it looks like we have 4 attendees at this time. If you would like to speak to the committee, just go ahead and raise your hand virtually now, or if you're calling in, you can press *9 on your phone. I'm not seeing any hands raised.
Okay, then I'll go ahead and close the public comment period. And that takes us to item 8, which is adjourning the meeting. Brian Thane, go ahead.
Just quick request, I believe early in the meeting when we were talking about GARE, there was a reference to GARE presentation on the 22nd. Can staff share a link to that? I'd be interested in checking it out.
Yes, that's my first order of business as soon as we adjourn, is to forward that information.
Okay, thank you.
Okay. Thank you, Jill Nixon. Thanks, Brian Thane. Any other items before us here this morning? Okay, seeing none, I'll go ahead and adjourn the meeting. Thanks to everyone for your participation this morning, and have a good rest of your day. Take care.